Hello viewers, this will be the continuation of the previous episode which we have discussed regarding the medications. So in this episode I will be telling you about the common medications which I used and what are the possible common side effects which you can experience because of these kinds of drugs and things like that. So coming on to the topic directly, I have told you a brief classification of drugs in the previous episode. So based on that I am just discussing few medical terminologies here also. There is a group called calcium channel blockers. So the common drugs which are included in this is amlodipine, cilnidipine, nifedipine, benidipine, felodipine and things like that. So when taking these drugs, you should make sure that these drugs are taken usually once or maximum up to twice a day. The common side effects which you can experience because of these drugs are headache and flushing, that is kind of redness over the face and arms and things like that, and tachycardia, your heart rate can increase. Sometimes you might experience even palpitations. Okay, and most commonly what we experience is swelling of the feet. Both your feet will be swollen after taking drugs like amlodipine, cilnidipine and things like that. So these are the common side effects which are linked to these medications. The other group of medications in the calcium channel blockers are diltiazem and verapamil. Usually they are given as once daily in the extended release form, or if they are short acting they can be taken even up to 3 times a day. So the common side effects which are experienced because of these drugs are your heart rate can reduce, that is called bradycardia, and because of these drugs there can be some problem in the conduction delay between the atrium and the ventricle, that is in the heart. There can be some signal problems and you can also develop like constipation, that is you might face difficulty while passing your stools. Mostly it can be because of verapamil. So these are the common side effects which you can experience when you are taking some calcium channel blockers. And the next would be RAS inhibitors. In that we will discuss on ACE, ACEI, ARB and renin inhibitors. Coming to the ACE inhibitors, so there are different drugs, class 1, class 2, class 3 like that. So enalapril, that is an older drug which people are still continuing, and captopril, perindopril, ramipril, lisinopril, all then another drug called quinopril. All these are common drugs which are used still in clinical practice. The other group is ARB, angiotensin receptor blocker, losartan, telmisartan, olmesartan, valsartan, irbesartan, candesartan, azilsartan, it has come latest. So all these molecules come under ARBs. These are usually taken once or maximum twice a day. And regarding the direct renin inhibitors, we don't use it much. Aliskiren is the molecule, but we do not use it much in the day-to-day practice. So what are the common side effects which you can experience because of these ACE inhibitors? I told you, enalapril, ramipril, captopril, all those drugs. So common side effects is dry cough. You can have dry cough. You won't have expectoration, you won't have phlegm, you will have dry cough. Mostly it may be in the nights, and your kidney function can become bad sometimes. And because of these drugs you can have some allergy reactions. You can have angioedema, that is your mouth will be swollen, your arms will be swollen, you will have itching, sometimes you may have difficulty in swallowing, things like that. And there can also be some skin reactions also, allergic reactions, as I already told you. In whom these drugs should not be given, that is contraindications. It should never be given in this set of people. People who are pregnant, people who are having severe kidney problems, say creatinine is more than 2.5 or 3, and people who are having high potassium. Normal potassium is around 5 to 5.5 usually in the most of the labs. So suppose the value is more than the normal value, then these drugs should not be given. And people who are having bilateral renal artery stenosis, few people who are having this disease will be knowing, both sides, if your renal artery is blocked, then those patients should not be taking these ACE inhibitors. And suppose you are having something like cardiomyopathy or obstructive cardiomyopathy, then you should not be taking ACE inhibitors. Next comes the ARBs, or the angiotensin receptor blockers, which are also commonly used. So before using these kind of drugs, what we usually do is we check the potassium levels in the blood and the kidney function test before starting the treatment, and within 6 weeks maximum there should be a repeat check checkup done of the potassium and the kidney function test, because as I said earlier, there is chances of your kidney function test and your potassium levels worsening. So suppose there is more than 20% increase based on your baseline value, then the drug should be stopped. Possibly that drug may not be the right option for you, so you will have to stop that drug. Suppose say your creatinine is 1.5 at starting the drug, and after say 2 or 3 weeks you are getting your creatinine checked up. So suppose it is 2 and you see 0.5 increase, so it is like 20% more. 1.5 20% would be somewhere around 1.8. so suppose it's more than 1.8, then you'll have to stop the drug. You'll have to stop and watch for the creatinine to come down, or you may have to choose the another options which are available. Mostly this ARB and AC all have the common side effects, when the and the contraindications are the same, like pregnancy or bilateral renal artery stenosis or cardiomyopathy and things like that. In the previous episode, as I already told you, for new onset diabetes mellitus, suppose a patient is having diabetes mellitus, then these drugs are preferred, AC inhibitors and ARBs. The thing is that they prevent the kidney disease progression, so it is indicated for almost all patients with diabetes. The other groups of drugs are diuretics. Diuretics means they in the body the diuresis will happen, that is there will be volume loss through urination. So what are the common drugs which are used as diuretics? One is hydrochlorothiazide, chlorthalidone, indapamide. They come under thiazide like drugs. The other drugs will be furosemide and torsemide, loop diuretics. The other drugs are amiloride, triamterene. These are potassium sparing drugs. There is also another group which is aldosterone receptor blocker, in which spironolactone and eplerenone is there. Usually people will be taking hydrochlorothiazide and chlorthalidone or torsemide for their BP control. Even spironolactone is used. So these drugs should be taken only once or twice maximum. Once is the preferred treatment, or suppose twice is indicated by a doctor, then you should be continuing twice per day, and they are better to be avoided in the evenings and the nights. The thing is that after consuming these drugs, you will have more of urination, frequent urination. So suppose you are taking it in the evening or your night, your sleep may be disturbed. So to avoid that, you should be taking this preferably in the morning. And what are the common side effects of these diuretics? Like thiazide diuretics, which I told you, they can reduce your sodium, hyponatremia. They can also reduce your potassium, hypokalemia. They can reduce the magnesium level, hypomagnesemia. They can increase the uric acid level, uric acid in the blood, so it can cause hyperuricemia. They can also increase your LDL cholesterol, that is bad cholesterol they can increase, and they can also reduce your good cholesterol, your HDL level can decrease. So these side effects should be taken into consideration before starting your treatment, or after starting your treatment. You should have an eye on these kind of parameters to see if you're not going into the complications because of these side effects. Not all patients will develop these side effects, but few patients or many patients do develop these kind of side effects. So you should be very precautious about these kind of side effects. The other drugs are aldosterone receptor blockers. It contains spironolactone. These are usually preferred for resistant hypertension. As I already told you, when you have taken 3 drugs and your BP is not controlled, then you might change the drug, and spironolactone could be a very good drug. And it can also be given in primary aldosteronism or low renin hypertension, things like that. What are the common side effects with these kind of drugs? Hyperkalemia, your potassium can increase because these are potassium sparing agents. Your potassium level in the blood will increase. You can have gynecomastia. Suppose, for example, males will be having increased swelling in their chest, that is called gynecomastia. There can also be erectile dysfunction in males, and there can be menstrual abnormalities in females. So when you are taking these drugs, you should have an eye on your potassium, because your potassium can increase at any point of time. So you have to make sure that your potassium levels are normal. The other group of drugs are beta blockers. Earlier days, these beta blockers were the first line agents. Like every doctor would be giving you beta blockers. For example, even now few elderly people will be knowing, they will be still continuing atenolol, Aten 50, things like that. So these drugs were used previously as first line agents when we did not have better drugs to be given. But now, since there are better drugs and research has given more preference to other drugs, the other group of drugs are used. These beta blockers are now used only for secondary prevention, or maybe as after trying out all the possible options, suppose your BP is still uncontrolled, then only your beta blocker will be given. The common drugs under beta blockers are atenolol, bisoprolol, metoprolol, acebutolol, carvedilol, labetalol, nebivolol, things like that. These can be used up to once or twice per day. The common side effects which can be experienced because of taking these drugs are, suppose you are having diabetes and your BP and your sugar is going down, then when you take these beta blockers, then you may not experience the symptoms of the hypoglycemia or the low sugar, because these drugs will mask that effect. So hypoglycemia masking will be there. Sometimes these drugs can also increase your blood sugar levels also, and there can also you might also experience something like weight gain. Your weight can increase, you can have more of tiredness, depression can be there, and your BP may not be constant at all point of time. It can be, BP can be varying between different levels. And what are the contraindications for these agents? Asthma, if you are having asthma or COPD or some breathing problem, then these drugs should not be given. And people who are having severe bradycardia, that is heart rate is very less, then these drugs should not be given. Suppose you are having a atrioventricular block, then also these drugs should not be given. The next group of drugs is central agonist. In this group we have clonidine, moxonidine, and methyl dopa. The side effects of these drugs are rebound hypertension. Once you stop these drugs abruptly, your BP will shoot back to very high levels. So that is called rebound hypertension. You can also have dryness in your mouth, you can have sleep disturbances, males can also have erectile dysfunction. So I have discussed with you the common medications and the most common side effects and the contraindications which are experienced out of these common medications. So this is all we have regarding the drugs. The dosage part, actually your doctor will be the best person to decide on what dosage will be necessary to control your BP. Usually we start with a lower dosage and then we titrate it to the maximum dosage. So I may not be discussed because different molecules will be coming in different strengths. So I have discussed regarding the common side effects which are a concern for most of the people, and what you have to be doing, like checkups, for example AC inhibitors and ARBs. You should be checking your potassium and your kidney function test, and if you are taking spironolactone or available in market as aldactone, then you should be checking your potassium levels, things like that. And so in this episode this is all we have for you. In the coming episode we shall discuss more about the other common problems experienced in hypertension patients or because of blood pressure. Please kindly subscribe to our channel, share the videos, and do click on the notification bell for regular updates, and do like our videos and click on the like button. See you in the next episode. Stay healthy and God bless you.